Curse the span where lay beneath the hands that guide me. Now I know why the lines of your
Tissues. Epithelial, connective, and membranes are the type of tissues that we're going to talk about today. Tissues are groups of cells of the same type and function working together. So again, epithelial tissue, connective tissue, muscle tissue, and nervous tissue are the four key types of tissue found within the body. Some tissues are grouped together to form organs or an organ. And did you know that most large organs contain all four types of tissue? If we think about the uterine tissue or the uterus itself, it contains epithelium, it contains connective tissue in its ligaments, it contains a lot of muscle, and of course it contains nervous tissue in order to receive messages from the brain and from the body. So we'll start with epithelial tissue. Epithelial tissue covers all the ducts and the body cavities in the body, so the mouth, blood vessels, thorax, bladder, etc. 6 main functions of epithelial tissue: protect, cover, and line, filter biochemical substances, absorb nutrients, provide sensory input, manufacture secretion, and manufacture excretions. Now, secretions and excretions, we'll talk about the two. Secretions, I'll go into it later. We'll go into full detail about the two to describe the characteristics of each. So we're going to take some time to focus on the different types of epithelia in the body. Each epithelial cell has an apical surface and a basal surface. The apical surface faces the lumen, or the outside of the organ, and the basal surface faces the basal lamina and blood vessels. So the basal surface, think of it as the basement. It's attaching the cell to the interior mechanisms of the body. The lateral surfaces are connected to neighboring cells by junctional complexes, which we'll talk about in detail. And epithelial cells are avascular. They rely on other aspects of the body, nutrient channels and matrices to bring them nutrients. Most epithelial cells are innervated, meaning that they have nerve reception, so they're able to interact with a nerve to receive impulses. That should say matrix, sorry. Matrix-filled channels provide the cells with the nutrients that they need. The plasma membranes are connected via junctions to create a strong network of communication. There are 3 major types of cellular junctions: tight junctions, desmosomes, and gap junctions. Tight junctions are, as their name indicates, they are tight junctions, so they're quite tight together. Not a lot escapes between the junctions between the two cells. They're formed by the fusion of the outermost layers of the plasma membranes of adjoining cells, and they're found in tissues where there can be no leaks, such as the urinary bladder and the digestive tract. Because if we had loose junctions all over the urinary bladder and the digestive tract, then of course you'd be getting urine and fecal material escaping into the abdomen, which is not ideal. Desmosomes are mechanical couplings formed by filaments that interlock with one another. So actual little interlocking components over here on the right. Tana filaments extend from the plaque into the cytoplasm of the adjoining cell, and they're found in tissues that undergo repeated episodes of tension and stretching, tension and stretching, tension and stretching, such as the skin, the heart, and the uterus. Hemidesmosomes link epithelial cells to the basement membrane, and the basement membrane is, of course, that bottommost membrane that supplies blood, nerve, etc. Gap junctions have tubular channel proteins, so connexons, that extend from the cytoplasm of one cell to the cytoplasm of another cell. These allow exchange and passage of ions and nutrients, and they're found typically in intestinal epithelial cells, the heart, and smooth muscle tissues. Now, of course, I've mentioned the same organs in a couple different examples of junctions because different areas of each organ require different junctions depending on their function. Junction. So looking at the basement membrane, it's a meshwork of fibers that cements the epithelial cells to the underlying connective tissue. It's also called the basal lamina, It varies in thickness, and it helps prevent the cell from being torn off by intraluminal pressures, so by pressures against the cell. It acts as a partial barrier between the epithelial cells and the underlying connective tissue as well. And then on the other end of the cell, for surface, we're looking at surface specializations. So some cells aren't just plain old epithelial cells, but rather they have specialized characteristics that are designated according to their function. The surfaces of epithelial cells vary depending on where they are located and what role they play in the function of the tissue. Smooth, which is what we've looked at previously, which is just plain old epithelial cells. Smooth, microvilli, cilia, and keratin are some features that we're going to look at. So we're also going to look at what the difference between microvilli and cilia are. Microvilli are found in the gut. They increase surface area and allow for greater surface for absorption of nutrients and secretions. So absorption of nutrients and then, of course, allowing more surface area for secretions. Cilia are found in the respiratory tract and the oviduct to help move objects along because cilia are an aspect of locomotion. Cilia are longer than microvilli. So let's have a look at each. So this is smooth type epithelial cells found in the heart to allow blood to flow easily without catching in the heart muscle, across the heart muscle, of course. So then we have these little microvilli. So in the intestines, when we're talking about microvilli, we have villi, which are these small little finger-like projections on the folds of the intestine. Okay, so they increase surface area to allow for more cells to be available. Then when we break it down, looking at the makeup of each of these tiny little finger-like projections, we have microvilli, which is the same idea, but it's on top of the cell itself. So the villi are tissue that increase surface area, and the microvilli are these tiny little finger-like projections from the epithelial cells that increase surface area for the cell itself. So it's like a little brush border. On the other hand, cilia, this picture cracks me up. I love it. I love super basic pictures. So cilia, on the other hand, are more used for locomotion either of the cell itself, especially in single-celled organisms, or locomotion of something away or toward an area of the body. So cilia, again, are little projections off the cell. They're larger than the microvilli, and the purpose is to move something along. So whereas microvilli on the cell here, the purpose is to increase surface area for secretion or absorption, cilia is to move things along. Oh, and then lastly, going back, keratin. Keratin, so the epithelial cells of the outermost layer of the skin get impregnated with keratin in order to become waterproof and create a barrier. So keratin impregnated cells act as protection, is their main function. So now we'll look at the classification of all the different epithelial tissue, at least just the structure of the cells themselves. Epithelial tissue is classified based on the following characteristics. Number of layers of cells, so if they're simple, which is one layer, or if they're stratified, which is more than one layer. Shape of the cells, such as squamous, cuboidal, and columnar. Presence of surface specialization, such as cilia, keratin, etc. So we'll start with simple squamous epithelium. They're large, flat, cornflake-shaped epithelial cells, and there's the presence of a small, oblong nucleus. They offer little protection. They're very fragile. They're found in areas of gas exchange, pericardium, peritoneal, and pleural cavity linings. You may have heard the term squamous before. We talk about squamous a lot when we're looking at cytology, so overall tissue cytology. And of course, squamous cells that have gone all crazy with cancer can turn into squamous cell carcinoma too. So that's another reference that you might have heard in regard to squamous cells. Simple cuboidal epithelium, so again, simple means that they're one layer, and cuboidal means that they're cubes. Large central nucleus, and they have areas of absorption, we find them in areas of absorption and secretion. We commonly find these guys in salivary glands, thyroid glands, the pancreas, anywhere that secretion is occurring all the time. Simple columnar epithelium, based on their name, we know that they're one layer and they're little columns, so they end up being tall and slender with an oval nucleus. Non-ciliated, we find those in the gastrointestinal tract. Ciliated, we find in the bronchi of the respiratory tract as well as in the oviduct. We often find them in areas of absorption and secretion. And in the GI tract, we have microvilli or goblet cells as well. So not only do we have ciliated, we can also have smooth, and then we can have microvilli as well. So then the difference between mucus and mucus, this came up, I believe, is it in your text or was it was in the reference notes that were passed on to me. So just a little note, mucus, M-U-C-U-S, is a noun, and mucus, M-U-C-O-U-S, is an adjective. So the actual fluid that comes out of your nose when you're congested is mucus, so mucus is snot. And the linings of your body that secrete mucus are mucous membranes. So it's describing the type of membrane. Random piece of information that I know you all really wanted to know about. So then we'll have a little look. So these, if we look back, so this was nice, simple columnar epithelium. This specifically was ciliated columnar epithelium, typically found in the respiratory tract. And then here, we also have ciliated columnar epithelium with goblet cells in between. So the reason I brought up mucus is because these goblet cells, which are a form of epithelial cells, are mucus-producing cells, which we often see next to the ciliated columnar epithelial cells in the respiratory tract, because along with deferring foreign materials out of the respiratory tract, we're also producing mucus continuously. This is really important, a little bit of clinical application. So parvovirus and Panleukopenia, which is a parvovirus. Parvovirus is a really serious virus that puppies and older animals can get, any animal can get, but that affect dogs specifically. And the virus goes in and attacks the epithelial lining in the GI tract, so throughout the intestines. Same with Panleukopenia, but Panleukopenia is for cats. So parvovirus causes sudden attack of the gastrointestinal epithelium, which ends up that these cells aren't able to do their job. So these cells throughout the GI tract aren't able to secrete, they're not able to absorb nutrients, and what ends up happening is that these animals start to slough their GI tract, which is really awful. So the epithelial tissue starts to lose its attachment and starts to slough away from the residing tissue. Something to be aware of because it is a primary attack on the GI tract. And of course, you will always get to know about parvovirus and Panleukopenia because they are one of the most contagious infectious diseases available to dogs and cats. So if you have a puppy who has parvovirus in your clinic, they need to be in isolation. And any dog that comes into the clinic who's not vaccinated they definitely have to be handled by somebody who hasn't already touched the parvovirus dog. So it's just something, a little bit of a clinical application because we are talking about the epithelial cells of the gastrointestinal tract. This disease here, this virus specifically attacks those and of course will kill the dog or cat. So we need to catch this before their intestines are completely ruined in their growth phase. Really unfortunate disease. All right, moving on. Pseudostratified columnar epithelium. The cell nuclei are found at different levels across the length of the tissue. Some cells do not reach the luminal surface, and they're found in the respiratory tract and in portions of the male reproductive tract. So again, as the name indicates, they are pseudostratified columnar epithelial cells. So we know that they're in columns, so they're long, thin tubes. Pseudostratified means that they are pretend stratified. So they're not technically in two layers. They're actually in one layer, but they look like they're in two layers because the length of the cells differ. So they're all attached to the basement membrane of the cell so that they're not susceptible to the luminal pressures, but not all of the apical surfaces of the cells reach the lumen. Okay, so they're kind of interesting in that way. So pseudo kind of means sort of. Normally these are in the respiratory tract, most often ciliated with goblet cells in between. And then we have stratified squamous epithelium. These are multiple layers of tissue lining the mouth, esophagus, and vagina. tends to form a fairly thick membrane, and they protect the underlying tissue. And this is how they're set up, lots and lots and lots of squamous cells on top of each other. And then we have stratified columnar epithelium. So again, stratified means more than one layer, and most often it's the layer that's closest to the lumen. The luminal layer is that layer that is columnar, so it's the longest, most tube-like layer. They're found only in select parts of the respiratory, digestive, reproductive systems, and along some excretory ducts, such as sweat, salivary, and mammary glands. They function in secretion, absorption, and protection. Stratified cuboidal epithelium, usually 2 layers of cuboidal cells, primarily found along large excretory ducts. They protect underlying tissues, and they're beneficial in secretion and protection. So we will, actually I'll go into the next one. Transitional epithelium. Now, transitional cells you will hear all about in your lifetime as a registered vet tech, because we're often looking for changes or abnormalities in the numbers of transitional epithelium when we're looking at urinary samples, so urine samples. These are stratified epithelium with a basal layer of cuboidal or columnar cells and a superficial layer of cuboidal or squamous cells. They are found in areas of the body that are required to expand and contract as part of their normal function. Expanding, contracting. Good example is, of course, the bladder, the ureters, urethra, and calyxes of the kidney. These form leak-proof connections, which again is so important when we're talking about the bladder and any kind of tissue that connects to secure the urine in the urinary tract. So transitional epithelium, we often look at it in urinary samples to ensure that it looks normal, that it's not showing any signs of transitional cell carcinoma, that we're looking at it in regard to its numbers and its characteristics. Do they look normal? Are they clumping? Are they sheeting? Etc., etc. So you'll hear all about transitional epithelium in your lifetime. Glandular epithelium. So we're going to talk about glandular epithelium, and then we'll get into a little side chat about the endocrine and exocrine glands, because we're on the topic of glands. Glandular epithelium. So secretions are specialized protein molecules that are produced in the rough endoplasmic reticulum, packaged into granules by the Golgi apparatus, and discharged from the cell. This should link back to your memory about our talk about the cell and all the various organelles within the cell. So they are produced in the rough endoplasmic reticulum. The Golgi apparatus takes them, it modifies them, it packages them, and then discharges them from the cell. That's what secretions are. So if we go back, remember the Golgi apparatus is its own little packing, modifying, and distribution center. Remember. So this is all to do with secretions. This is starts our clinical application of those tiny little cell organelles. So we find a lot of glandular cells when we're talking about endocrine and exocrine. Endocrine, it releases secretions directly into the bloodstream. So anytime we're talking about endocrine system, we're talking about the release of secretions for use in the body. They produce and secrete hormones into the bloodstream or into the lymphatic system, and it's part of a complex biochemical network known as the overall endocrine system. Examples of an endocrine gland, of course, are the adrenal gland, thyroid gland, pituitary gland. Exocrine system, on the other hand, and exocrine glands discharge secretions via ducts directly into local areas or systems. Unicellular or multicellular, an example of exocrine gland is liver, pancreas, sweat, and salivary glands. So we're going to talk a little bit, just going off on a little bit of a sidetrack here, to talk about the difference between endocrine and exocrine, and then we'll be able to link this back up later in your program as you go through your schooling. So what are common endocrine gland diseases? Now, the endocrine gland we already talked about. We have examples of the adrenal gland, the thyroid gland, the pituitary gland. What are some common endocrine gland diseases? Well, we've got hyperthyroidism, which affects cats. Hypothyroidism affects dogs. And hyperthyroidism, essentially, there's either a lack of a feedback loop happening in the thyroid gland, or the thyroid gland is malfunctioning, and it's producing too much of the thyroid hormone. Now, thyroid hormone is responsible for everything in the body. It's responsible for metabolism. So your thyroid hormone, if we have too much in production, it's creating too high of a metabolism, which means higher sweat production, higher heart rate, higher respiratory rate. Everything is really high strung. So oftentimes with cats, we see a cat that looks pretty normal on the left, and then hyperthyroidism kicks in, and they start to lose weight, lose muscle, their heart rate's really high, and their owners describe them as hyperactive. Common with hyperthyroid cats. Totally treatable. There's nice little tapazole tablets that they can take to reduce that. And then, like I mentioned, hypothyroidism in dogs. They get this. Cats get hyper. Their thyroid is not producing enough thyroid gland or thyroid hormone. So what ends up happening is their metabolism suffers and their metabolism becomes quite slow. So with that, we tend to see decreased immune function, their skin, they start to lose their hair. We see really a lot of weight getting put on, no energy, they look quite lethargic. And then over time, they can develop this sort of mask as well, where their face takes on a very specific shape. And essentially, it's because all of their little systems don't have the metabolism to carry on. So their connective tissue isn't connecting to the muscle very well, et cetera, et cetera. So these guys look really dumpy, really big, and quite lethargic. That's hypothyroidism due to a lack of production of thyroid hormones. Another example is diabetes mellitus. Dogs and cats get this, and this is where the thyroid or the pancreas isn't responding to the high blood glucose by producing insulin. So the pancreas has endocrine properties whereby it gets feedback from the body to identify how much glucose is floating around in the blood. And if that blood glucose is high, then normally it would start pumping out insulin to start reducing that level of glucose. Unfortunately, in diabetes mellitus, there's two different types, which we won't get into. They just aren't able to recognize that high level of blood glucose, and their pancreas becomes non-responsive or poorly responsive to high blood sugar, and they just don't produce insulin. Another example of endocrine disease is Addison's disease in dogs. Mostly dogs get this. Technically, cats can get it too. But most often it's in like 2-year-old female dogs, such as this beauty right here. This is Leia. So Addison's disease affects the adrenal glands, which is all part of the endocrine system, and they stop producing cortisol. And when they stop producing cortisol, what happens is that the body doesn't respond very well to stress. So with a sympathetic nervous system reaction, we should get vasoconstriction, we should get increased heart rate, we should get all of that when those stress hormones kick in. And those compensatory hormones kick in, but unfortunately with Addison's and a lack of cortisol, they just don't kick in. So when Leia would get stressed out, her body would give up. She would lose all her blood pressure, she would become really lethargic, and then long-term, of course, as well, untreated, it starts to have an imbalance in the electrolytes in the body. So her sodium got really low, it was all over the place, and she went into an Addisonian crisis. So essentially, Addison's disease, we typically find out that dogs have Addison's disease because they go into a huge crisis mode whereby their body just tries to give up. So it's a funky one. We'll talk about it later in your career in school. Leia also, this dog here, my fabulous Great Pyrenees, had separation anxiety like crazy. So I shamed her, as I do. And I put her a little sign that says, I thought the picture on the wall was a window. I tried to escape through it. What happened? She had separation anxiety. She tried to go out the window, as she often did. Our neighbors would find her on the roof. And when she tried to go out this window, she realized it was a picture frame, and she broke the window. So dogs who have high stress and Addison's disease don't do particularly well because it is an illness that's kicked into high gear during stressful times. All right, moving on to exocrine gland diseases. So this is a common exocrine gland disease. This is exocrine pancreatic insufficiency. So the pancreas I mentioned plays a role in endocrine diseases, so it plays a role with diabetes mellitus. The pancreas also has a role in exocrine function, whereby it secretes enzymes to break down food. So in this case of exocrine pancreatic insufficiency, it's really common in young German Shepherd dogs, and they just have really disgusting yellow bile-colored diarrhea. It smells horrifying, and they get really skinny. And what's happening is that their pancreas isn't able to produce those enzymes needed to break down the food product. So it just gets shifted through the intestines without fully being broken down and digested is the key and absorbed. Another one that has to do with the pancreas and is an exocrine disease is pancreatitis. And that is inflammation of the pancreas. So that's an angry pancreas. It's most common in schnauzers. Schnauzers have a number of ailments that are common to them. And essentially, the pancreas can get really sensitive if we start changing up the animal's diet, if we increase the level of fat in their diet, then their pancreas can get angry and go on strike. And when it goes on strike, it's very, very painful. They start to get diarrhea, they vomit, because their pancreas stops secreting the enzymes needed for digestion. So I've mentioned the pancreas a few times now, so it's important to notice that the pancreas definitely is Mr. Popularity, and it's involved in exocrine and endocrine function. And we'll come back to that when we talk about the digestive tract. So those are nice little side notes just to connect epithelial all the way to exocrine and endocrine glands, because again, everything in anatomy and physiology links up to itself. All comes back. Okay, so we're going to talk about connective tissue. I just want to point out that the background on this slide is actually fat cells, and they are the most beautiful cells. I love adipose tissue. So those are beautiful fat cells in the background. Connective tissue is the most abundant tissue in the body according to weight, and examples are fat, bones, ligaments, tendons, fascia, cartilage, blood, etc., etc., etc. So the list goes on and on. The functions of connective tissue are to form metabolic and structural connections between other tissues. It forms a protective sheath around organs and helps insulate the body. Think about fat. Acts as a reserve for energy, provides the frame that supports the body, such as bones, composes the medium that transports substances from one region of the body to another, such as blood, and it plays a role in the healing process and in the control of invading microorganisms. We're going to talk about the different types of connective tissue in the body, and I have to admit, this is where it gets a little bit dry unless you have an extremely significant interest in connective tissues. So I will try my darndest to bring in clinical applications as much as possible. Components of connective tissue, we have the extracellular matrix, so the background outside the cells, which includes extracellular fibers and ground substances. The ground substance is the medium through which cells exchange nutrients and waste with the bloodstream. It acts as a shock-absorbing cushion, and it helps to protect the more delicate cells that it envelopes. In addition, its thick texture serves as an effective obstacle for invading microorganisms, although some microbes are so smart they've developed the ability to produce the enzyme, which degrades so they produce a specific enzyme which degrades hyaluronic acid and enables the microbe to actually move with great ease inside the tissue. So generally, the ground substance can help defend against microbes, but there's a lot of microbes out there who just break it down. They're smart. And then, of course, we have the cells, which we'll talk about. So you can go through the extracellular fibers. There are 3 different types of fibers. We're going to talk a little bit about each. I'm not too worried about you guys knowing all of this. So collagenous fibers are strong, thick strands of collagen organized into bundles of long, parallel fibrils composed of bundled microfibrils. The variable density and arrangements of fiber are present within these, and they're found in tendons and ligaments. Reticular fibers, they're thin, delicate branched networks of collagen. They provide support for highly cellular organs such as endocrine glands, like we talked about, lymph nodes, spleen, bone marrow, and liver. They're also found around blood vessels, nerves, muscle fibers, and capillaries. And then we have elastic fibers, which are branched networks composed primarily of the protein elastin. They're composed of coiled bundles of microfibrils, and they occur in tissues commonly subjected to stretching, such as vocal cords, lungs, skin, and walls of blood vessels. These fibers altogether, these fibers tend to be present in all connective tissue, so all 3 of them. The function of that connective tissue will determine sort of the ratio between the types of fiber present. The most popular fiber in all of the world, or in all of the body at least, is of course collagenous fiber. So we're going to talk about cell types, so the type of cells that can be found in connective tissue. Fixed cells. So fixed cells are involved in production and maintenance of the matrix. We have fibroblasts, chondroblasts, osteoblasts, adipocytes, and reticular cells. So each type of connective tissue is characterized by a specific type of fibroblast. Fibroblast is essentially it's the baseline connective tissue cell. And then when the cells get designated to a specific area of connective tissue, such as cartilage, then they change into chondroblasts. So chondroblasts are associated with cartilage, osteoblasts are associated with bone, adipocytes are associated with fat, and reticular is connective tissue with some possible immune response. As they become older cells, so adult cells, then we drop the suffix blast and they become cyte. So it would be fibrocyte, chondrocyte, osteocyte, adipocyte is the older version, etc. Transient cells are involved in the repair and protection of tissues. So transient cells, we're talking about leukocytes, we're talking about mast cells, and we're talking about macrophages. These are your leukocytes. This is a platelet. These are two platelets, macroplatelet and regular platelet. But the white blood cells we're interested in are neutrophils, lymphocytes, eosinophils, monocytes, and basophils. Leukocytes are white blood cells that wander from blood into tissue during times of infection or cleanup. They either physically eat foreign invaders, so they can phagocytize, or they produce an immune response to foreign invaders. Mast cells are covered with histamine. So mast cells are nice little cells with all these purple granules all over, which is histamine. They circulate close to blood vessels. When they identify a foreign invader, they burst open and release histamine into the bloodstream. This is the initiation of a systemic allergic reaction and inflammation. And then we have macrophages, which of course are my favorite cell. They are specialized cells that engage in phagocytosis. They can either be fixed or transient in connective tissue. So if they are fixed, then they typically are named for their location, such as Kupffer cells or Kupffer cells, which are macrophages only found in the liver. And thank you for creating this, whoever created this. I will absolutely accept people posting if they know who created this fabulous phagocytosis image. All right, connective tissue proper. So aside from the matrix, this is actual connective tissue we're talking about. We've got loose connective tissue, which includes areolar, adipose, and reticular. We have dense connective tissue, including dense regular, dense irregular, and elastic. And we'll talk a bit about each. Areolar connective tissue is loose connective tissue, most common type of connective tissue in the body. Fibers and cells suspended in a thick, translucent ground substance, moderately elastic, and its predominant cell is the fibroblast. This manufactures the elastic, reticular, and collagenous fibers. Areolar connective tissue surrounds every organ and forms a subcutaneous layer that connects skin to muscle. So if we think about cats and dogs, they have really loose areolar connective tissue. And just think about that. It's a loose connective tissue. If you were to scruff a cat, you easily can because their skin is very loosely attached to their muscle with this areolar connective tissue. Whereas us, we have a tighter connective tissue where if we pick up our skin, we can't quite scruff ourselves the same way that we would with a cat or a dog. So it envelopes the blood vessels, nerves, and lymph nodes, and it's present in all mucous membranes. Adipose tissue is another form of loose connective tissue. It is cells filled with lipids, and we'll find it around muscles, joints, in the bone marrow, beneath skin, around organs, etc. We find adipose tissue everywhere. It acts as an energy storehouse and a thermal insulator. Most adult animals have white fat. Newborns and hibernating animals have brown fat. So again, looking at storage of nutrients, then it starts to turn, an energy storehouse and storage of nutrients. Those animals that need to store nutrients in fat and use it more so as an energy reserve are going to have more brown fat. And these are my babies. These are my adipose cells. They show up the nicest on cytology when we're looking at them in fourth semester. Reticular connective tissue it's again another example of loose connective tissue. It's a network of thin reticular fibers. It contains loosely arranged fibers and many fibroblasts suspended in a supportive ground substance. It forms the stroma, so the outer layer of several organs. So here's an example of the stroma. Essentially, we're talking about the capsule and a couple layers deep. Okay, so the stroma is the outer layer of most organs. And then we're going to get into dense regular connective tissue. It's composed of tightly packed parallel collagen fibers. It's relatively avascular, so not containing a lot of blood connections throughout, and it makes up the tendons and ligaments. It can be found in the fascial sheets that cover muscle. So we'll start talking about fascia when we talk about muscle. Fascia is the membrane that covers all muscles, and there's thicker layers of fascia that separate muscle groups from each other. And then we have really thick bands of fascia along the abdomen here, and of course the thoracolumbar fascia here. Okay, it's the white area indicated on this muscular dog. Dense irregular connective tissue composed primarily of collagen fibers arranged in thick bundles. The fibers are interwoven to form a single sheet, and it's found in the dermis of the skin and in the fibrous covering of many organs. It forms the tough capsule of joints, so the joint capsule itself. And we have elastic connective tissue, primarily composed of elastic fibers. Fibers may be arranged parallel or in interwoven patterns with fibroblasts and collagenous fibers interspersed. It's found in spaces between the vertebrae and in areas of the body that require stretching, such as the walls of the arteries, the stomach, the bronchi, the bladder, etc. Specialized connective tissues we'll move on to talk about. We have cartilage, such as hyaline cartilage, elastic cartilage, and fibrocartilage. We have bone and we have blood. Cartilage is found in joints and in the ear, nose, and vocal cords. It forms a framework on which all bone is formed. So you guys can find out more about that in the other PowerPoint about the physiology of bone. No innervation, so it doesn't have a lot of nerve sensitivity to it or nerve interaction, and it's avascular. Cells involved with cartilage are chondrocytes. Anytime you see chondro, we're talking about cartilage. And they live in the hollowed out pockets in the matrix of the cartilage called lacunae. The matrix has ground substance, which is gel of chondroitin sulfate, hyaluronic acid, and chondronectin. I always have to think about that before I say it. Collagen fibers are most commonly found in the matrix, but elastic fibers are also present in varying amounts. Hyaline cartilage. We talk about hyaline cartilage a lot. So it's the most common type of cartilage found in the body, and it's composed of closely packed collagen. So it's a fairly strong, fairly dense cartilage. It's found in joints at the end of long bones. So that's that articular cartilage. It is made up of hyaline cartilage. Growth plates of long bones in young animals before they ossify. Tracheal rings are made of hyaline cartilage, and connections of the ribs, that costochondral junction, and connection of the ribs to the sternum, we're talking about hyaline cartilage. So the costochondral junction is that junction between the bone and the cartilage of the ribs, and then of course that last third of the ribs is made up entirely of hyaline cartilage. Composes most of the embryonic skeleton enclosed within a perichondrium, and that of course we talked about in regard to ossification. So looking at our beautiful articular surface here, this is a stifle joint. We've got the distal aspect of the femur, the fibella, and the patella. And then here's the articular surface here. So that is formed with articular cartilage on top of the end of the bone. Likewise here, a beautiful image of a long bone and the articular surface of the long bone. So this is typical anatomy of a synovial joint. And then we have elastic cartilage. So this contains elastic fibers in dense branching bundles. It's flexible, can withstand repeated bending, and it's found in the epiglottis of the larynx and in the pinnae of the ears. So looking at this, we know that we can pet our cat's ears and our dog's ears repeatedly, kind of fold them as we're petting them, and they spring back into action, similar to this German Shepherd here. However, there is a condition that will destroy the shape of the ears. Number one is, of course, cropping the ears, when people cut off half of their dog's ears in order for them to be erect instead of floppy. Highly, highly unethical. That will destroy the cartilage to a point, causes a lot of scar tissue. Another one that we see commonly in clinic is an oral hematoma, whereby the dog or cat had chronic itchiness in their ears, and they scratch, scratch, scratch. They self-mutilate by scratching, and what happens is that the connective tissue that connects the skin to the cartilage in the ear gets disrupted, so it gets dismantled. And when it gets dismantled and they're scratching, then all the blood vessels rupture, and they get this balloon of blood in their ear. So that's an oral hematoma. Dogs, a lot of times, will do surgery on it and will re-tack the skin back down to the cartilage. Cats, it's debatable. A lot of vets debate whether the whole process of anesthetic and then healing from the surgery, if it's truly a benefit, or if we just let the ear heal on its own. Cats, the surgery, it's tricky too, because sometimes their ears curl up anyways after surgery. But generally, if the surgery is not performed, then they get this thing. So this dog's right ear had an oral hematoma at one point, and now it has cauliflower ear, where all the cartilage has shriveled up because it's not well connected to connective tissue in the skin, and the cartilage lost its form and gets shriveled up. It's fine. You just have to watch out for ear infections in that ear because, again, sometimes the cartilage and that clump of skin and cartilage is blocking the outer ear canal. So they can get a little bit more prone to ear infections. My cat has this. She's got cauliflower ear. It's the same cat that sounds like Darth Vader that you hear in some of my videos. She has an odd increased pedal pineal reflex, so she's continuously scratching her ear, and she doesn't have anything in her ear. We've swabbed the heck out of it, checked for yeast, bacteria. So anytime you go to pet her ear, she gets hyper aesthetic around her ear and she starts scratching the heck out of it. Well, of course, she ended up with an oral hematoma. I let it heal on its own, and now she has this cauliflower ear. She doesn't care. She's happy. All right, fibrocartilage, usually found merged with hyaline cartilage and dense connective tissue. It contains thick bundles of collagen fibers with fewer chondrocytes than hyaline cartilage, so fewer cells in general than hyaline cartilage. It lacks a perichondrium. It's found in spaces between vertebrae of the spine, between bones in the pelvic girdle, and in the knee joint. And then we have bone, and the matrix is a combination of organic collagen fibers and inorganic calcium salts. Very well vascularized, has Haversian canal. The Haversian canal contains both a vascular and nerve supply. Canaliculi are channels within the matrix that support passage of blood vessels into deeper portions of tissue. Osteoblasts, of course, are bone cells. They manufacture the fibers that are part of the matrix, and we talked about these when we talked a little bit about the physiology of bone. Or we'll carry on talking about it with the physiology of bone. And osteocytes reside in the lacunae. Blood, the matrix is, we have the ground substance as plasma, the fibrous component is protein, and the cells involved in blood, of course, are erythrocytes, which are red blood cells, or RBCs, leukocytes, which are white blood cells, or WBCs, and thrombocytes, which are platelets. Carrying on, we have mucous membranes, or mucosa. They line organs with connections to the outside environment, such as the mouth, the intestines, nasal passages. If you pull your eyelid down, you can see the conjunctiva, that's mucous membrane as well. They're usually composed of either stratified squamous or simple columnar epithelium, covering a layer of loose connective tissue. Submucosa is the connective tissue layer that connects the mucosa to the underlying structures. So common example here, of course we have mucous membranes in the mouth, and we use them a lot to get a lot of clinical information about the animal. But here we're going to talk about the mucosa of the intestine, When we open up the intestine as part of surgery, so when the doctor's opening up the intestine, if we're doing a foreign body surgery with them, normally we're assisting in checking the health of the mucosa. And so the mucosa itself, looking at the mucosa directly, so gross evaluation of the mucosa, often gives a lot of information about how healthy that tissue is. If it's nice and pink, normal pink, happy pink, then it's happy, healthy mucosa. If this were a foreign body surgery and there was something stuck in the intestine, cutting off circulation to the mucosa, the doctor might have to actually transect the intestine because the mucosa is in poor health. And we'll talk a little bit more about that afterward in the layers of the intestine. So mucous membranes continued, they may contain goblet cells or multicellular glands. They can produce large quantities of mucus, thinking about the GI tract, etc. And mucus consists primarily of water, electrolytes, and the protein mucin, which gives it its slipperiness and sliminess. Some mucosae or mucosa can also absorb, such as the epithelial layer in the intestine. Now, mucous membranes, I mentioned, they tell us a lot about the health of the animal. So this is, as an RVT, we're often assessing animals. So if an animal comes in, they can't walk, or they come in, they've been vomiting for days, they've got diarrhea. The first thing I always check is the mucous membrane color, because that's going to tell me a lot. If they're otherwise, like I've already noticed that they're breathing okay, their mentation is normal, those are the first things I technically check. And then I flip up their lip and I look at the mucous membrane color. Because if the mucous membranes are healthy pink, nice and glossy, that helps me identify where they're at in regard to being critical or stable. If I flip up the mucous membranes or the lip to look at the mucous membranes and the animal looks like this, I am going to bump them up in line because this animal has serious liver issues. So this is, going back, healthy mucous membranes, they're pink, they're shiny, and then this is diseased mucous membranes. So anytime we see yellow mucous membranes, we identify it as icterus. And of course, that refers directly to them having a problem or failure of the liver. So this is not good. And here we go. If I flipped up a lip in the exam room and the dog has this is quite pale mucous membranes, then I'm going to rush this dog to the back, to the treatment area, because they have some sort of anemia or shock that's happening in their body. So they are not perfusing blood to their mucous membranes very well. Blood is being conserved to the main organs in the body. Not ideal. If the mucous membranes are blue, that animal does not have well oxygenated blood going through their peripheral venules and arterioles. So I'm going to bring that animal to the back too. So they're like a little window. I love mucous membranes because they give us a little window into the health of the animal. Serous membranes, or serosa, they line the walls and cover organs of body cavities. So the thoracic and abdominal pelvic cavities consists of a continuous sheet doubled over on itself to form two layers, and the portion of the membrane that lines the cavity wall is called the parietal layer. The portion of the membrane that covers the outer surface is called the visceral layer. We'll talk about this a lot when we start looking at the pericardium and other layers of tissue and of organs in general. In the abdominal pelvic cavity, visceral layers of serosa merge to form the mesenteries, and the mesenteries we'll look at when we talk about the gastrointestinal system, because it's the mesenteries that keep the organs organized within the abdominal cavity. So looking at our layers of gastrointestinal tract, to put it all into perspective, this is the inside of the organ. Or sorry, no, technically this is the hollow area that's contained, contained in the intestine. So looking at this, the brown flaky area in the middle, that represents, let's say, food product going through the gastrointestinal system, so going through the intestine. The first layer is the mucosa, and then we have the muscularis mucosae, so that's the small muscle layer of the mucosa. Next up, we have submucosa, and then, of course, muscularis, so the large muscular layer that makes up the gastrointestinal tract, subserosa, and serosa. So all of these layers that we've talked about, these connective tissue layers, make up the gastrointestinal tract along with muscle. Cutaneous membrane, also called integument, it's composed of an outer keratinized stratified squamous epithelium, or epidermis, And remember, keratin, keratinized, means it's been injected with keratin and it acts as a protective and waterproof layer. The epidermis is attached to an underlying layer of dense irregular connective tissue called the dermis, and the dermis contains collagenous, reticular, and elastic fibers, which enable skin to be both strong and elastic. And then we have synovial membranes. They line the cavities of joints. They're composed of loose connective tissue and adipose tissue covered by a layer of collagen fibers and fibroblasts. They manufacture the synovial fluid that fills the joint spaces. So they secrete synovial fluid that surrounds the joint spaces. And then, of course, we have muscle tissue, which is composed of actin and myosin fibers. There are 3 types of muscle tissue that we will talk about in detail when we talk about the muscles: skeletal, smooth, and cardiac. So skeletal, this dog here is representing all the skeletal muscles, the superficial skeletal muscles, at least, of interest. And then we can find cardiac muscles, which of course we find in the heart. That's what it really looks like. And then we have smooth muscles, which include multi-unit smooth muscles, such as those that constrict and dilate the pupils. And then we have visceral smooth muscles that you would find in that other picture I talked about throughout the gastrointestinal system. So throughout the intestines, throughout the stomach, the esophagus, the uterus, etc. And we'll go on and on about those. Likewise, we'll expand on nervous tissue. So nervous tissue, it's found in the brain, spinal cord, and peripheral nerves. It's composed of 2 general cell types, the neurons, and then the supporting neuroglial cells. The neurons are the longest cells in the body. They have 3 primary parts. The perikaryon, which is the cell body, contains the nucleus, dendrites, short cytoplasmic extensions, those are those finger-like extensions, and then the axons are the long single extension which conducts impulses away from the cell body. And the perfect little picture up here. Neuroglial cells, they support the neurons. So we will expand, definitely. There's a whole presentation on the skeletal system. There are 2 presentations on the muscular system, and there's a presentation to come on the nervous system. So for now, that's the end.
It's slow.